we get started here, but I'm going to go ahead and kick off tonight's meeting. Thank you so much to everybody for being here tonight and giving us your time on this beautiful evening. We really appreciate it. I'm going to begin this meeting with a land acknowledgement tonight. So this webinar takes place on Nadakana, which translates to our homelands, that is now called New Hampshire and Vermont. Nadakana is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki peoples, past and present. We acknowledge and honor with gratitude the land, water, air, flora, and fauna, and the human beings who have stewarded Nadakana throughout the generations for 12,000 years. Tonight, we have Dr. Seddon Savage, who is a member of New Hampshire Healthcare Workers for Climate Action's Board of Directors, who will be introducing Dr. Hogan and moderating our Q&A. So with that, Seddon, I will pass things over to you.
Yeah, so thank you so much, Emily. And thank you in particular for that land acknowledgement. I always feel it really helps ground us in our relationship with the natural world and in an appreciation of the care and stewardship by the Indigenous peoples who spent so many thousands of years caring for the land so well, particularly in our climate work. It's a great grounding. So thank you very much. And good evening to everybody and a happy summer solstice. I think somehow it seems particularly meaningful to spend time considering how we can improve the health of our planet on this, the longest day of the year. So thank you for taking time out of your evenings to join us. I also wanted to thank the New Hampshire Public Health Association and the New Hampshire Medical Society who are co-sponsoring tonight's presentation. Tonight, we're going to focus on health system actions, concrete actions to reduce climate change. And I'm going to introduce Neal Hogan in just a moment, who's going to lead us through that. But before I do, very relevant to tonight's presentation, I did want to mention, and I mentioned earlier to some of you who were on, but others have joined us, that the Policy and Advocacy Work Group of New Hampshire Healthcare Workers for Climate Action is considering embarking on a really coordinated effort to support health systems in New Hampshire to come into alignment with the goals that were recently established by the U.S. Department of Health and Human Services that are aimed at getting the U.S. health system to net zero emissions by 2050. So as we listen tonight, I wanted to encourage all of us to think about how we can apply some of the principles and practices that Neal's going to share with us into productive action in New Hampshire. We're a tiny state, and I hope it's not unrealistic to imagine that we might get every single health system in the state on track within the next couple of years to achieve net zero by 2050. Perhaps a pipe dream, but something we can really sink our teeth into and work towards, I think. So if you're interested in these efforts, please let us know. Thank you for thinking about how we can do this as you listen tonight and discuss tonight. So now I'm really honored to introduce Neal Hogan. Neal is chairman of Healthcare Climate ActionWorks, which is an entity that's dedicated to best practices in emission reductions and to helping health systems engage in climate action. He's author of the book, Leading on Climate Change, How Healthcare Leaders Stop Climate Change. He has a BA from the University of New Hampshire and a PhD in the history of science from Harvard University. He has been described variously as a brilliant thought leader and a natural educator and inspiring speaker. So I think we're extremely fortunate to have him both on the advisory board for New Hampshire Healthcare Workers for Climate Action and as our speaker tonight. So thanks so much, Neal, for joining us. And as you're putting up your slides, I think you're going to be showing your slides.
I am.
I just want to ask people, as you listen to Neal, if you have questions or comments or anything resources you want to put into the box, into the chat, please do so as he's speaking, and then we'll have you unmute and ask your questions, make your comments, or you can raise your hand and we'll call on you when it's appropriate. So thank you, Neal.
Thank you, Seddon, and thanks, Emily, for putting this together, and thank you for that incredibly humbling introduction, which I'm going to probably have to lower everybody's expectations very quickly as soon as I can. So one, just thanks for inviting me. I'm so excited about this organization. I am a lifelong New Hampshireite, been here for several generations, and it's a tough state to do work in. Some of you know that I'm on the board of a health system in Oklahoma, and I joke that when I gave the CEO of that organization my book, I gave it to him in a brown paper wrapper because I didn't want other people on the board to know that I was working on climate change, because it's kind of a gas state, but it's also a huge wind state. So I think it's a great goal to try to get health systems in New Hampshire on board for the 2050 goal by 2025. I'm kind of trying to shoot for moving the entire industry. There's about 550 major health systems in the United States. I always say maybe 20 are doing a lot on climate change right now. Maybe another 20 or 30 are starting to engage. And then there's these 500 that we've got to get off the dime and get working on this. So as I was thinking about this today, and I was talking to my CEO, Jonathan Fullerton, and one of our researchers, Pam, they were asking me, so for this group, how do you pitch it? This is a key question for us whenever we give a presentation. How do you pitch it? So in the last week, I have given presentations where I literally was explaining what is net zero emissions, or what are the scopes of emissions, or what is ESG, some really basic fundamentals. And then I go from there to another conversation where I'm talking to people who are, they've already completed scope 1 and scope 2 and are at zero emissions and are working on scope 3 and trying to figure out how to get their vendors and their whole supply chain to change. So how you pitch this is very confusing to me for any audience. So I hope I've got the right thing. So let me walk you through kind of how I'm thinking about it. So I'll talk to you a little bit about how I got here. And then I'm going to try to not spend too much time on the challenge. It's more to tell you about how we frame it at Healthcare Climate ActionWorks. And this might help when you're talking to health system executive teams. And then our theory that health systems are actually central to this overall challenge of transitioning to renewable energy, how systems develop a climate strategy, and then last, lessons from the research we've done on implementation for this. So I got into this back when I was in graduate school. I have a degree in the history of science, but I worked on history of medicine. But when you get a degree of history of science, the kind of idea is there's not too many universities you're going to end up at that there's more than one historian of science. So you're going to be the historian of science. So when you're trained, you have to know the history of physics, the history of chemistry, the history of environmental sciences, the history of medicine, whatever. And then you focus on the area that you want to write your dissertation on and kind of work on for the rest of your career. And so I took history of environmental studies at that time. And I'd always, like all of you probably, I participated in Earth Day and I recycled, and I thought I was a very good guy. And then I was in classes with guys who did nothing but think about this all the time. And that got me getting much more interested in it. And it just happened to be at the same time that Bill McKibben wrote his first book, that there was the testimony to Congress. And so it got me interested in it. But like all of you, I had my career. So I was building up my career. I went on to the advisory board company and helped launch the advisory board company and take that public and then run other businesses. And I did that on my career side. And then on my personal life side, I did things with the Sierra Club and helped 350.org get launched and try to do all the things myself, like have solar and hybrid cars and all that kind of stuff. And then a couple of years ago, my business partner, who I've done a lot of different projects with over the years, said, you ought to actually combine your climate change passion with what we do as a business. And how would you do that? And just instantaneously, I said, I know exactly how to do it. We work with health systems. We've been doing it for 30 years. They're not doing anything on climate change. We got to find a way to get them to move. That's our thing. Other people have their thing. And that's going to be our thing. So that's how we got into this a couple of years ago. And we came out of a world where we did research on best practices and helped health systems figure out how do you improve throughput in the emergency room, or how do you reduce adverse drug events. And we said, we got to do the exact same thing. We're going to talk to health systems, find out how you do it. And then we're going to share that with other health systems, and we'll go in and help drive down change. We've actually altered a little bit because we've realized that we're going to have to help health systems make some big moves if we really want to change emissions. And I'll talk to you about that a little bit. So I wrote a book and I launched this company a couple of years ago. So how we frame the challenge is we start with, because we go and we speak to places in Texas, we speak to places in Oklahoma, we speak to places in Alabama. And so we start by saying, we love energy. We actually, all of our lives loved oil and gas and coal. because it enables to have hot showers and air conditioning and travel and fly in planes. And it is not a bad thing. However, the way we're producing energy right now is bad. It has a bad impact and a bad effect. And so ultimately what we want to figure out how to do is transition from the energy system that we have now to a new energy system. Now, I don't talk to those health systems about it this way, but I actually believe this is going to be the greatest battle in human history, because 36 of the top 100 largest companies in the world are oil and gas companies, 6 of the top 10. And if we're telling them that the trillions of dollars of their valuation has to go to zero, that's not going to go smoothly. And I think we're going to see them do everything humanly possible to prevent us from winning. So it's going to be a very, very tough fight. I call this the obligatory hand-wringing slide because you guys have heard all of these things over and over. It's now at 420 parts per million as of 10 days ago. CO2 is rising. I'm not going to go through this with you guys because of this. But just this week, I spoke to a health system in Kansas and I spoke to a health system in New Mexico. And that's photos taken from the last 7 days. Fires in New Mexico, so Presbyterian Health System in New Mexico, I was speaking to them, and one of the ED docs said to me, it's so interesting you had that slide because we can no longer go to any of the parks to take a hike in New Mexico. They've all been shut and we can't go. And so it's not climate change is coming, it's happening. And in Kansas, now it's almost 3,000 cattle have died in the heat wave. They've been killed by heat. So not by storms and fires and thunder, floods. They've been killed by actual wet bulb temperatures too high for cattle to survive. And as you guys well know, our theme that we say all the time is the climate crisis is a health crisis. And I don't think I need to beat on this for you guys. I think some interesting data the Climate Impact Lab has come out within the last week that's really interesting is if you just look at heat, not storms and flooding and so on, and fires, just heat because of the nature of wet bulb temperatures like we're seeing in Pakistan and India will kill a huge number of people because they don't have air conditioning. We have air conditioning, we can go hide in it. But if you don't have air conditioning, you will just die of heat prostration. Oops, I went backwards. The other thing Climate Impact Lab has done, which is really nice, and I recommend, I put the website there in the bottom, lifesaved@impactlab.org, is they allow you to put in different places and calculate if you went to zero based on this, and you can see, how they do the calculations. Based on their calculation, how many people will be saved and how much money will be avoided in spending by fixing the climate crisis. So if you can get to 100% clean electricity by 2050, we save 5,000 lives here in New Hampshire, and we avoid $2.2 billion in adaptation costs. If the United States gets there, we'll save 1.6 million lives and avoid $750 billion in adaptation costs. I've seen different ways of calculating this to come out with slightly different numbers. I like theirs, but there's a lot of different ways to do it. And you can look at the background of how they do theirs. I've lost my ability to control my slides. There we go. Okay. And then we talk about, if you really wanted to solve this problem, there's only 7 ways to do it. Just to make it very simple for people. It's not really complicated. We can switch to all renewables all the time. So every machine has to be converted to a renewable machine. You can't burn anything anymore to heat your house or travel anywhere. We could build thousands and thousands and thousands of nuclear power plants. We could believe that there's going to be some technology which allows us to sequester the carbon from fossil fuels and just go down that road. We can believe some miracle technology, fusion, will save the day. For any of you who took a lot of physics, there's a classic joke in physics, fusion is just 15 years away, which has been true since 1970. There's kind of the 70s model of environmentalism, which is, if we all just moved to a yurt and we didn't do anything fun, then we'd be fine. Then there's, we don't do anything and who cares because MIT's developed bubbles that we're going to put in space and they're going to solve the problem. Or we just have huge carbon taxes. So it's, some mix of those would work too, but we did this so we could say, well, what's our point of view? at Healthcare Climate ActionWorks. Our point of view is very easy. First, you do want to become more efficient because you need to build less new power plants the more efficient you are, right? So if a building is 30% inefficient, you've got to build 30% more solar than you should need to. So we want to help health systems do that. We want to maximize efficiency. Then second, we want to electrify everything that they do. So every piece of transport, every building that they have, every part of HVAC that they do, all sterilization, the manufacture of the concrete for their buildings, the steel manufacturing, everything they do, we want to make electric. And then we want to make that electric generation renewable. And that's not going to solve everything because it doesn't do things like anesthesia gases and other things, but we think this is will be a big chunk. Then there's this one small thing that almost no one talks about, but there's a whole industry around this. There's guys at Nori, which is a company trying to create a marketplace for carbon capture in the US. We're going to still have to take out 1 trillion tons. So even if we go to zero emissions, we've put so much carbon in the atmosphere, and we will continue to do so for quite a while, that carbon is like little light bulbs all around the earth, just glowing softly. But those light bulbs keep on heating, and they keep on heating and keep on heating. And the earth will keep heating even with the carbon we have up there. So we're going to have to take that out. That's not going to be my problem. I'm leaving that to my child. She's going to have to solve that one. But it's something to keep in the back of your minds, particularly when people say, can't we just use carbon capture to solve this? I hope we develop great carbon capture because we got to get out the 1 trillion tons that's up there. The good news, which I love to talk about because I think it's such a depressing topic, but there's so much great stuff happening. I hope you guys have a lot of people speaking with you. If you go to conferences in climate, it's just amazing how many super smart, young, energetic people there are that are trying to work on solutions. It gives you a lot of confidence. Solar, we've dropped the cost by 85%. Our capacity is growing at 33% a year on a compound annual growth rate. Tons of capacity has been installed. Wind energy, also dramatic declines, 50% declines in wind. We installed more wind in 2020 than any other year. We haven't got the total numbers for 2021 yet. Battery power has grown at 35% since 2020. Electric vehicles went up 94% in 1 quarter last year. We're just going to see the adoption rate of electric vehicles be astonishing. And hydropower has grown at 14% worldwide. So there's a lot of cool stuff that's already happened, let alone technological innovations that are coming out in the future. And so I'm very confident we can get this accomplished if we get to work on it. DOE, sorry, we had one more button to push, has efficiency rules that they put in place. So federal buildings have to do retrofits of their buildings to reduce their utilization of electricity and gas. Then there's always this question about what about the politics side? I am not super bullish about the politics slide. There's an old joke that Ronald Reagan used to say, which is the 9 most terrifying words in the English language are I'm from the government and I'm here to help. And I like to say to people, I think we've now heard more terrifying words like we've run out of ventilators, I think is more terrifying than that. Or your cattle all died in the heat wave. Or I'm sorry, you just lost your house because of the fires in the back or to the ocean. And despite that, I think it's very difficult to get politicians to move on this. COP26 happened last year. That means we've had 26 of those conferences. And we've solved climate change. But no, we haven't. We've had 26 of those conferences, and we have barely moved the dial. We've got one side calling climate change a hoax in our American politics. And the other side is discovering, it turns out if gas prices are high, you don't get reelected. So let's unleash the taxes on gas and end those, which is what Joe Biden said today he's going to do. So I don't see either side really wanting to take on that huge fight against those trillion-dollar companies, which means the folks on this call are going to have to solve this problem brick by brick, one step at a time, trying to get movement down the road on this. And so I'm doing what I can, and you guys are going to be in the same place, which is let's work in healthcare. Let's try to get healthcare done. And there's other people I know that are trying to help get it done with manufacturing. There's other people I talk to that are trying to get it done with, technology and electronics. So I just feel like we can't wait for the politicians to solve this. We can we can vote that way, and we can push to get it done. And I spend my money on politicians to try to want to do that. But I think that it's going to be much more important that this group and the people that I'm talking to, we're just going to have to work at it. And that leads us to health systems as superheroes. Really, there's no reason to call it this section that, except I wanted to put this slide in for Marvel Comics. I think I've worked with health systems my whole career. They're not a well-known quantity in American thinking. They're the largest not-for-profit in almost every community in the United States. In most communities, they are the largest employer in most communities. So you have this huge not-for-profit organization dedicated to improving the health of their communities. They are the natural place to actually drive this entire project to me. And yet they're not that excited about it. So I'll talk about that a little more. And then once you get them going, they need a strategy and they need to get started in implementation. We got to show them how to do that. So this is the very first white paper that we put out, was 9 reasons why health systems need to work on climate change now. I'm sad at how evergreen this is because I think we're going to be using that white paper with health systems for a long time. We're probably going to update it and update the reasons and the gist of it. But, one, you improve the health of your community. It can lower your costs. Access to capital. So health systems really survive on their investments. So they have their operating income. So you got 10,000 people that work at a health system. They generate a certain amount of operating income. And then you have your investment income, one guy who's in charge of your investments. At most large health systems I work in, that one guy makes more profit than the 10,000 people. So they take their bonds very seriously. So bond rating is very important. And the bond folks are saying, we're starting to engage in environmental analysis of your organization to determine your bond rating. That's a very big reason for health systems to make this transition. Recruitment and retention, I've had more than one health system, people pull me aside as I'm talking to them and say, we were trying to recruit this guy from wherever, Mayo, to come work in our emergency department. And he asked us, what's your sustainability program? And we don't have one. I think that more and more young folks are saying, I want to work someplace that's got a sustainability program, and I want to know what it is. So if you don't have it, they're going to go to the competitor that does. To protect your brand and grow your share, consumers have the same thing. 4 out of 5 consumers say, I want to buy from places that are environmentally correct. Health system emissions are going to be hard, so we got to get started now. We should improve health system emissions because it's a big social equity problem and a social determinants of disease problem. We're leaders, and we should leave a healthy climate for children and grandchildren. You can download that if you want to read that more in depth. But that's the gist of what we're telling the health systems is there's a lot of reasons for you to work on this. And then whichever one we find is the best angle in, we go after that. We have found the best angle in is CFOs, because they are hearing from Moody's and Standard & Poor's that they want to know what their emissions are, and they want to know what their plan for emissions are. They also want to know what are your climate risks, right? Are you in a place that's going to have flooding or hurricanes or fire? So we want to know that before we give you your bond rating. So we found the largest law firm that works on those bonds, that help them figure out their bonds and buy their bonds and make the bond deals, is a firm called Oric. I thought they were a vacuum cleaner company, but I learned that Oric is this huge law firm. So we have partnered with Oric to do a program to try to teach CFOs about this, to try to teach them about the impact of climate change, why it's a health system issue, and why they, as CFOs, have to think about it. And we're doing a summer webinar series with them, and we're going to do a conference in October just for CFOs to try to get to that angle. So even though I think it's a healthcare issue, I think the number one person we're able to get at is the guy who doesn't have an MD. If I can get the CFO of the system, I feel like we've really made a big push. So then once we're in, we've got to start thinking about what's the climate strategy that they want to develop. So I know you guys all know about scopes of emissions. The vast majority of people who are in healthcare have no idea what the scopes of emissions are. And I was interviewed a couple of weeks ago on a podcast by the Academy. It's the Health Management Academy, and it's a huge organization. Hundreds of health systems are in it, and they do programs for executives in health systems. And the woman who's the CEO of that is super smart. She's got her finger on the pulse of what healthcare executives are. The whole podcast was her asking me definitional questions. It was, what's zero emissions? What's GHG? What are ESG? What is this? So we got a long ways to go. And any education you do in New Hampshire will be fantastic. So I just walked through, it's whatever comes out of your buildings is 1, 2 is your electrical source, and 3 is basically everything else, your whole supply chain. Accounting for emissions is the first thing these guys want to do, because they want to know, they want to benchmark. They want to be like, where are we compared to the guys down the road? Where are we compared to nationally? How are we doing? And then they want to be able to find, are we lowering at the rate of everybody else? Years ago, when I did work on adverse drug events, I did a meeting, and the very first meeting we did, we were walking through these 27 practices to reduce adverse drug events, and somebody raised their hand and said, well, what's the benchmark? And I said, well, what do you mean? They said, well, what's the acceptable number of adverse drug events? And I said, 0. Like, benchmarking on something where you really don't want any of them. Yeah, it's nice, but all it's doing is making you feel comfortable that you're not as bad as the worst guy when you just want to be as good as you can. I feel the same way about this. Greenhouse gas reporting, and you may have already heard about this, but it's a big problem. There is no standard for emissions accounting in the United States. The Europeans have a standard, we do not. The EPA has a greenhouse gas reporting program, but you can choose which method you want to report using. And so you can have different sort of calculations of how you evaluate your emissions, which means you can try to find the one that makes you look as good as possible. The Securities and Exchange Commission now has proposed climate rules, which would have a specific amount for every organization that either floats bonds or has stocks. And since all health systems float bonds, they will be in this. They don't even know about this yet. They're really not paying any attention to this. But within 2 years, this will have come in, and health systems will need to account for their emissions, and it'll be a standard. So they need to get working on it now to get an understanding. And just a note on this, like Henry Ford Health System, we talked to them and we said, have you figured out, what your emissions are? And they realized that they're a huge organization, multiple hospitals. I think they have 20 something hospitals, hundreds of buildings between urgent care clinics and their clinics and medical office buildings. And they realized that they didn't know what their single utility bill was, because every part of their organization gets their utility bill and pays it out of their own operating income, right? And so first they had to figure out, how much electricity do we use? Which took them 2 years just to figure out their electrical use. And then we wanted to back into, where does that electricity come from? And, if it's coal or oil, we can calculate the emissions. So it's not an easy thing to do this emissions calculation. US health system emissions have been calculated by many people. You've probably heard the story of it's around 8, 9, 10% of total emissions. This is from my friend Chaz Rhodes at GIST Healthcare. They did a really nice piece on this, where they summarized the research to date. And they said 65% comes from the supply chain, 10% from travel, and 25% from the delivery of care. I called Chaz and I said, I really loved your graphic, but I'm going to add a red line to it because I feel like it's hard to run a hospital without food. And I think that should be not in the supply chain, that should be in the operations of the organization. That's in delivery of care. So, this is a good rough estimate nationally. This wouldn't be any one health system. But I then just took that and I took not the supply chain, which is in your purview as a health system, but you would solve it just through contracting, right? So you'd contract and you'd say, if you want to sell stuff to us, you got to show us your zero emissions. That's going to take 30 years, but that's how you'll do it, right? But I see the rest of it as really in your own purview. How are you going to decrease your emissions from travel, delivery of care, food? And so we put it into this pie chart, same numbers. And what we do for an individual organization is try to look at this for their own organization. But right off, what comes out is that building energy, HVAC and electricity consumption is a quarter of the whole thing, right? So you would definitely want to work on that. Then it's amazing to me, patients, visitors, and staff commute, just the driving back and forth to the hospital, it's a huge amount of energy consumption. So anything we can do to reduce that, really, really big. Food and catering, again, and as you go down, anesthesia, inhalers, water, and waste. But that building energy thing really struck us. And when we looked at some individual health systems, it was even bigger than that 25%. So that's sort of a national composition. So we've tried to figure out how would we tackle the building energy piece. And I'll get back to that in just a second. So here's the strategy for the health systems. You've got 5, 6, 7 basic things that we tell health systems you got to do. So this is what we show them when we say it's not that complicated. First, you've got to learn about climate change and how the whole thing works and how you reduce. And you've got to get your board to understand that. The executive team's got to understand that. And really, we think the medical staff and the management have to understand it. Then you got to find your baseline. So what are your emissions? There's not a perfect way to calculate emissions, but let's get a sense of what yours is so we know what that pie chart looks like, so we know which to go after first. Then where do you get your energy, right? Is it electrical from coal? Is it from gas? Are you already getting 50% from renewables? So in Oklahoma, strangely, a red state that does not really care about climate change yet, because of their enormous amount of wind energy, most of INTEGRIS's electricity comes from a renewable. They didn't do it on purpose, it just accidentally. They live next to 4,000 wind turbines that drive the electricity for them. Then you find the ROI. So if you look at things like we're going to change the LED bulb, every bulb to an LED bulb. Well, how much does it cost to do LED bulbs? What do you save in electricity costs? And what does that look for? We include, you've got to think about health benefits for the community. Ultimately, you're going to have to think about getting to your bond rating, and you're going to have to adjust how you think about ROI. It's not just going to be a dollar figure, it's going to be a total impact figure, excuse me. Then you set a reasonable net zero goal. Common Spirit, the largest health system in the United States, Lloyd Dean, a fantastic CEO, is getting ready to retire. And he decided that as he was getting ready to retire, he would announce their net zero goal. And he announced that they will be net zero by 2035. And I was super excited this, and I called him up and I said, how'd you do that? And he goes, what do you mean? I said, how'd you know you can be net zero by 2035? He goes, what do you mean? I said, how do you know you can actually get there? Well, I just said we're going to do it. So that was not really the best way, Lloyd. I love you. I don't think you're going to be net zero by 2035. It sounds great. You're going to be retired 3 CEOs from now. There's going to be a guy there in 2035. It's not going to be great for him. So set a reasonable goal based on the previous work we talk about. Build out your multi-year strategy. So how are we going to get there? Are we going to be halfway by 2030? Are we going to be 3/4 by 2040? What are we going to do? And then do some stuff that you win early and you demonstrate we are working on this. You want everybody to understand it. So that's our basic, before we get into a deep strategy that's localized with that one system, this is the basic way we think about it. Okay, how do we implement the lessons in the research? I think I lost the slide. Oh, no, I did. Okay, good. So implementation, what we discovered 2 years ago when we started this journey was there weren't very many people to learn from. Not many people in healthcare had implemented much. Right. So Gunderson Lutheran in Wisconsin, Boston Medical Center, Kaiser Permanente, New York Langone, a few others, those were like the leaders. So we had to go out of industry to find some of the big ideas. And so we stuck with, for out of industry, let's pick their biggest ideas. Like rather than, how do you implement things? Because health systems are going to say, yeah, but we have ORs and it's different when you have that. So let's just focus on their overarching thinking. And we picked 4 places that have sort of an iconic piece of this overarching thinking. Patagonia has got the greatest mission statement I've ever read in my life. Their mission statement is, we are in business to save our home planet. So everybody at Patagonia goes to work every day and they think about, I'm designing this jacket, or I'm selling this piece of clothing, or I'm trying to figure out where we're going to put a store. And they think, how are we going to save our home planet? One of their values is, we're going to conduct all operations in a way that causes no unnecessary harm. So it's sort of the, the oath that physicians take, and it says no unnecessary harm. They're saying it for their business. I wish every health system would adopt that, because immediately we would have to get off of emitting any kind of gases. IKEA, when we researched them, what was really interesting about IKEA, unbelievably complicated organization. I didn't really realize how complicated IKEA is. They make a lot of their own furniture. They're vertically integrated. They own forests where they harvest the forest to make the furniture to sell in the stores. They took, and instead of just having their leadership team work on the business, they took that same leadership team and they have a parallel job where they meet 6 times a year. And every one of them has metrics and goals that they have to achieve on emissions reductions and sustainability targets. Honeywell has gotten 85% to zero emissions. They've done that through 5,700 discrete projects throughout Honeywell. And they just have a great project management approach and team that shows how each project makes a difference to emissions reduction. And then lastly, Disney. I don't know if you guys have heard a lot and talked a lot about offsets and credits, but there's just a lot of questions about offsets and credits. The way we look at it is, if you have an offset that does not actually take carbon out of the atmosphere for at least 100 years, it's guaranteed to stay out of the atmosphere. It's not a real offset. So for example, Ramey Hemstreet at Kaiser's, their chief energy officer, he's done more on climate change than anybody in the industry. I give him a hard time because their offsets are, they buy solar stoves for families in the developing world, right? That is a wonderful thing to do. It keeps mostly women no longer have to go around try to find wood. They don't burn that wood in their house, which is not good for their health. But all that's doing is preventing carbon from going in the atmosphere. It's not actually taking it out. And so Kaiser's putting carbon in the atmosphere, and they're taking credit for not putting the atmosphere. And I say it would be even better if you took carbon out somehow. Keep doing the stove thing. Just put that under the foundation and then do this. Disney's super good about calculating their offsets and so on. So we walk them through that and explain that. And then when we get into implementation, this is it. It's 9 things you got to work on. Buildings, electrical source, the things that plug in, monitors, computers, MRI machines, HVAC, clinical care, all the things that the inhalers, the anesthesia gases, and so on. Transport, your supply chain, your partners. So partners would include, if you're a health system, you partner with SNFs, with home health agencies, with private practice physicians, and then your waste. How are you managing your waste? Because it releases a lot of gas. So electrical source goes back to my pie chart where I said building energy is 25%. So we really have spent the last year trying to figure this out. What do you do about that? You really need health systems to get off of their local electricity and into renewables. Hospitals, unfortunately, use a huge amount of electricity, right? So it's not easy to do that. So other organizations, Google, Amazon, Apple, and Kaiser Permanente, use 2 tools to make this work. And this is a little complicated, but if you think of your utility grid in the US, there's 3 utility grids in the US. There's the West Coast grid, which is basically everything west of the Mississippi. There's the East Coast grid, which is everything east of the Mississippi. And then there's Texas, which has its own grid, which is why Texas had that major crisis and a grid failed, because they couldn't draw electricity from the other 2 lakes. Strangely, and I now know more about grids than I ever wanted to, a quarter of Texas actually is in the Western grid. When this whole fight happened with Texas, a quarter of them said, we're going to stay in it. And that's where all the wind farms are in Texas. So they're actually able to sell their electricity in the grid. So those grids, New Hampshire's in the East Coast grid, think of it as like a giant lake. And there's rivers and streams and springs that are putting water into the lake. And then you have a stream where you take water out of the lake. And when you dip your cup into that stream coming out of the lake, you cannot tell where the water came from. And that's electrons in the grid. So electrons in the grid, the ones that are coming in my house, I have a huge solar field behind me. During the daytime, all coming in from there. But if it's cloudy, I'm getting other electrons coming into the house. And I can't really tell where the electrons come from. So what you can do if you're a big organization is you can have a power purchase agreement. And you can say, we're going to pay you, Mr. Utility, to make renewable electrons for the next 20 years. You give us a guaranteed price. And for 20 years, we'll make the same payment, which means we're going to save a lot of money because the cost of electricity keeps going up. And you're going to make a 10 megawatt solar farm or a 10 megawatt wind farm that didn't exist before. And then you issue a renewable energy certificate. These are regulated, that says we've done that 10 megawatts. And when you put that into the grid, we get to take credit for those electrons. Even though the electrons coming into our building might not be renewable, we're buying the renewable ones that are going in the grid, and we can take credit for that. So it's a little weird and complicated, but it does work. And so that's the way that Kaiser actually did it. They made an agreement with the utility company that built 2 wind farms and 2 solar farms. This is the way Google did it, Amazon did it, Apple did it. And then they get the credit. So even though the electricity actually coming into Kaiser's building in California doesn't come from that plant, there's no way to make that happen because you'd have to build a solar farm next to every building, have it piped in, and then have battery storage to make it work. So that's how it works. Once we learned all that and figured that all out, we said, is there a way we could do this for 500 health systems? It turns out there is. So we're going to announce this in the fall, exactly how this is going to work, but we are going to actually build hundreds of megawatts of solar and wind power in the 2 Eastern and Western electric grids. And then health systems will be able to contract with us for a percentage of that total wind, and we'll calculate what their electricity usage is, and we can bring it to 0 with a contract, just the way Kaiser did. Boston Medical Center has done their 100% of theirs with a solar facility in North Carolina. So we're super excited about this because if I back up, we want to, as a company, what we're trying to do is reduce emissions, and we want to get health systems to reduce emissions. We think we can reduce them by about 10% right off the bat. And my pitch to CFOs is going to be, we can reduce your emissions by 10%, and we can save you 10% on your electrical costs. And I am hoping that they say, oh, that sounds good. Let's do that. We'll see. I'll talk more later. So that's electrical source. Buildings. So buildings, there's 3 parts of working on buildings. One is your design of the building. One is the construction of the building. And one is you have a building that already exists and you need to retrofit it. Buildings are very important. They're 40% of total emissions in the US. And as I said earlier, about 33% of that energy is wasted. So building design, super exciting right now out in California. They're just starting the building of the world's first all-electric hospital. So this is UC Irvine. It's actually done in partnership with Kaiser. Has designed an all-electric hospital. Now, why this is important, hospitals use HVAC systems that are natural gas. So this will use an HVAC system that's all electric, and it will do its sterilization of electricity. And then lesser ones, not quite as dramatic as that, but Beechwood, Ohio, the University Hospital's Ahuja Medical Center there, without going all electric, has figured out a way to reduce its utilization of gas tremendously by state-of-the-art environmental controls that have the electric controls in every part of the hospital that control, their humidity and heat. insulation, ultra white roofs. So you can do a lot with the design of the building. Then in the building of the building, and again, I don't know how much you guys have heard about construction problems, but there's something called embodied carbon. When you build a building, it takes carbon to build the building. And the carbon that it takes to build the building is the equivalent of about 1/2 of the emissions of the building in operation for the rest of its lifetime. So if during the lifetime of a building, it emits 1,000 tons of carbon, there's 1,000 tons of carbon that took place just from building it. So if you can build it in a way that uses less carbon, you've tackled a big part of the problem. Every ton of cement is a ton of carbon. Every ton of steel is a ton of carbon. So there's a lot of work looking at new construction methods. An example of this is carbocrete. I don't want to get into how cement is made, but it's the problem of turning the limestone into cement. You release a lot of carbon dioxide. Carbocrete actually is made in such a way that it absorbs carbon dioxide. So each ton of carbocrete is negative carbon, because it actually, in the way they make it, it sucks carbon out of the air. So, as you build buildings that way, you're reducing carbon. You can also build buildings in innovative new ways. This is Enterprise Center at the University of East Anglia. It's the most sustainable large building ever built. You could build a medical office building that was exactly like this, and it has passive house certification. So basically, no carbon footprint of the embodied carbon of the building, and it makes no carbon in the operation of the building. And this is what we will see 20, 30, 40 years from now. Every building will start getting built like this. And then retrofits. Hospitals have a lot of buildings. They're not going to tear them down and build brand new buildings. So you retrofit your buildings. My favorite example of this is the Empire State Building. They did a major retrofit, took them 3 years. It reduced their energy use by 40%. So by changing all the windows and recaulking and putting in a new high-tech environmental management system and all new heating and cooling, they cut the use of that building by 40%. Now, what's unfortunate is if they had done this year, they could have actually put all heat pumps in to do that building, but now they're still got natural gas is operating that building. Clinical care. I'm not going to do every one of these 9, by the way, but clinical care. Have you heard about anesthesia gases, sevoflurane and desflurane? Somebody talked to you about that a little bit. So essentially, it's this guy, Brian Chesbrough at Providence. He's an anesthesiologist at Providence in, I think, Seattle, maybe Providence in Portland. I can't remember. He read that desflurane has much higher heat trapping power. It's a much higher greenhouse gas than sevoflurane, and it lasts 16 times longer in the atmosphere. So he started to do research to figure out how does it work as an anesthesia? Is it as effective? Are there patients you shouldn't use it on? And he built this huge database of research on this, and then started to present to the anesthesiologists that he worked with and said, I think we can switch to sevoflurane for the vast, vast majority of our patients. There are a few patients that they still would use desflurane on. And now he kind of goes out on the road and he talks to anesthesiologists about making this transition, right? So there's a direct clinical care one. Health Partners, which is a 8-hospital system in Minnesota, they just guided as many of their patients to virtual care, this is before the pandemic, as they possibly could. And they calculated the amount they were reducing patient travel and estimated how many tons of carbon they were reducing every time they got somebody to have a virtual visit versus a non-virtual visit. So that's another end of the spectrum. I think that clinical care is actually key to 8 of the 9 areas of focus. I don't think clinicians have much impact on where we buy our electricity from. I don't think they care. But I think if you look at the rest of this stuff, right? So what plugs in? You mean my monitoring equipment? You mean the MRI machine we're buying? You mean the computer I'm using? I care about that. I care about what plugs in. I care about the supply chain. These are preference items, right? Are you going to change my preference items based on environmentalism? It better be something I still like. Waste, the partners we choose, home health, and so on. So our recommendation with health systems is the clinicians have to be deeply involved in this entire process because the impact of changes we make will hit them, and they need to be comfortable with any change we make. Otherwise, we're just going to blow it. So we can, there's targeted clinical care items, but every other item has a piece of this. HVAC. Never in my life did I think I would spend as much time as I have learning and thinking about heating and ventilation systems. So there's so much you can do with HVAC, so you can switch to heat pumps, you can add up-to-date environmental controls and so on, but there's a problem for hospitals. And the problem for hospitals is hospitals have a very high number of changes of air in the building. So every time you draw in new air, you have to heat or cool that new air depending on the time of year. And this is all because of Florence Nightingale. She figured out ventilation. We all know the story of Florence Nightingale figuring out ventilation. And what's happened in that is that we now think there's a X number of turns per air required per hour. And so we have to put HVAC systems that do that. And therefore they have to be natural gas systems because electric systems, even heat pumps, can't manage to do the heating of that much new air all the time. What's fascinating about this is Ramey Hemstreet, again, the man who's done more on this than anybody else in healthcare, the chief energy officer at Kaiser, said, let's go research how many turns of air are best for reducing infection rates. And the most recent research you can find on that that's clinical is Florence Nightingale. There had been no research on this. What happened was the guys who build HVAC systems would go to the building codes people and say, higher is better. We can install a system that does even more turns of air, and you should make that part of the building code. And that's why we have a certain number of turns of air required in hospitals. Kaiser Permanente, very powerful in California, went to the state and said, we want permission to take one hospital and violate the building code and take down the number of turns per air. So they took it down 5%, they looked at infection rates. They took it down 10%, they looked at infection rates. They took it down 20%. They got it down to 30% and infection rates did not change. So that's a 30% reduction essentially in how much natural gas they have to use to heat or cool their buildings just by doing this experiment. That alone may reduce more emissions than anything else that goes on in healthcare. If every hospital in the world adopts this, that would be a huge impact. And then you probably know University of Vermont Medical Center because your relatives over there in Vermont are working on this. They actually extract biogas from landfills. And they take that biogas out of the landfill and they send it over into their hospitals and they use the biogas in the landfill. This is just more about efficiency, lighting, computers, monitors, imaging, everything that plugs in. We're just looking for a more efficient method of that. I talked to the guys at Siemens about this, and they said, we've done research on this, and the number one thing people can do in healthcare is turn the machines off. When they're not using them, turn it off overnight. No matter how we design the machine, we couldn't do as much as an operator can on doing that. Partners, I mentioned this, labs, SNFs, ambulance services, LTACs. Health systems are going to have to work with their partners on reducing their emissions and helping them drive their emissions down. And then finally, waste. This is one people don't think about as much, but we produce an enormous amount of waste in healthcare. If everything goes into a landfill and is not separated, then the composted material release that natural gas. And if it's not piped out into a University of Vermont hospital, the rest of the country, we don't really pipe it out and use it, then it's just going to the atmosphere as methane. And it's very, very bad for the environment. And of course, once you start managing your waste, you start to reduce the amount of non-recycled material you have, and that reduces the amount of plastic that's made, which reduces emissions. So that gets us to the end. And the last part of this is where I really started, which is health systems as superheroes. Our theory is you have a health system. I stuck Presbyterian's logo in here. And that health system starts to work on itself and it starts to correct its own emissions problem. And then they go to their employees and they say, we're going to work with you and we're going to help you get the tax incentives for you converting your home to heat pumps. And in fact, we're going to make a deal with a local heat pump company to get you a 20% discount. And we're going to deal with the local car dealership to get you a 10% discount if you buy an electric car. We're going to do things to help our employees make the transition. You can do the same thing with patients. Then health systems are the largest not-for-profit in every community they're in. They are also the most business-like of any not-for-profit organization and community. So they have advantages in how they think about problems and solve problems. They can lead community organizations to drive this further into the community, right? So the local United Way, the local organization that works with kids, they can do that. Then, of course, health systems are very powerful in states, as we know in our little tiny state. Dartmouth has outsized power in the state, so they can push for statewide action. They can work on the national supply chain. Once all health systems are demanding that their suppliers move, then the suppliers will move once they have enough of a bolus. And then finally, their national lobbying organization can say, we're here for health of our communities. This is not healthy for people. We need you guys to make some moves on this. And push that. And then that group, putting that all together was why we really think that they can drive it down the field. So with that, I will pause and take any questions, comments, assaults on my personal character. I will tell you, one other little thing about this. Working on this is what's led me to discover the nastiness of the Twitterverse / social media world. I get the most vile email hatred I have ever gotten in my entire life because I talk about climate change. I hope that doesn't happen to you. It's really remarkable. And I see that all as part of those 35 giant oil companies who do not want to give up their trillions of dollars. I think you're still on mute, Seddon.
Thanks so much, Neal, for a really extraordinarily comprehensive talk. You have given us so many strategies to think about. And I apologize on behalf of, I don't know who, for the vile email that you get. We always are prepared to put people in breakout rooms at our webinars and at our echo sessions in case they get like that. So yeah, we had you protected while you were here.
Well, that's good. Thanks.
We have a lot of questions. We have technically 3 minutes. What I'd like to suggest is that we take an extra 10 and we'll keep it at that out of respect of people's time. We'll go till 6:10. Those who want to sign off, feel free to sign off. I'm going to take the moderator's liberty of asking a first question before we go on to some of the short questions. So you talked about what may be short questions, they may be long ones, but you talked about the importance of early wins, how people get enthusiastic when they have early wins. So I wanted to ask you, if we're looking to make a difference in New Hampshire and we want everybody to have a win, is there a particular action or strategy across most health systems that's reasonably doable and will yield great benefits to people? Where would you start?
Yeah, the first thing I would start with is just find out if they switch to LED bulbs. And the reason is because it's got the highest ROI. So Cleveland Clinic did it. They changed 250,000 bulbs and it paid for itself in just 2 years. So, it's what CEOs call a paint the lobby project. You can't really get in trouble for painting the lobby. Everybody likes it when you paint the lobby. And then the other thing is, putting solar on your roof or on your parking garage or whatever is not going to generate, that's going to generate maybe 2% of the electricity you use. It's a very small amount, but we still recommend it because it's symbolic that it's like when Jimmy Carter put the solar panels on the White House, right? It's symbolic. And when Ronald Reagan took them off, right? It's a big symbol. And so it shows we are actually working on this and trying to make a difference on it.
So interestingly, I just have to say, when we talked to the facilities manager at Dartmouth Hitchcock about bulbs, that was the first thing he said too. We have 50,000, I can't remember the zeros, but lots and lots of them. And he calculated what he'd save, but getting the upfront money and people to agree with that initial investment was a challenge.
Yeah. I will tell you another problem with health systems from working with them for 30 years is that most things are decided by committee somehow. Like there's a group of people that decide it, and everyone in that group has veto power. And so getting health systems to change is just, I mean, I've been doing it my entire career trying to get them to change. It is not easy. And so you got to take multiple swipes at the apple. Keep going back and talking about the calculations, the difference it will make. And, just, it's a tough fight.
Right. Thank you. So Wes both has his hand raised and a couple of comments in the chat. So Wes, do you want to come off mute and make a comment or ask a question?
Well, thank you, Seddon.
Yeah.
And Neal, I want to echo what other people said. I thought it was a fascinating, great presentation. So much stuff that I almost fell asleep at the end. That said, my particular interest is in carbon pricing. And I'm acutely aware that the United States is one of 2 developed countries on the planet without any carbon pricing. I'm also acutely aware, having been lobbying Congress for about going on 8 or 10 years now, the challenge of making an impact. I'm also aware that the IPCC has said that the first best step that countries can take is to price carbon. Carbon taxing is regressive. It's incredibly regressive, and the population won't stand for it, as the French demonstrated when they put a tax on the taxis, and just the taxi drivers got nothing of it from it, and so they started rebelling. So all of this is lead up. I'm sorry. My question is, are you familiar with the carbon fee and dividend model?
Yeah.
And if so, what are your comments about it, please?
Yeah, one of the things I've learned about carbon taxes is that every time I think I know enough about it, I realize I don't nearly know enough about it because I talk to somebody who really knows a lot about it. But I've actually loved the carbon fee and dividend model because I like the idea that you collect the money from people, you give it back to people, and if I reduce my carbon calculation, right, then I get a big benefit out of it because I'm going to actually make money on the fee.
Exactly.
The problem, and I wish I could remember the podcast I listened to, but it's I think it's by Nori, which is a carbon capture company. They had a woman on who actually developed multiple ones of the carbon pricing schemes, like the California one. She worked on some of the European ones,
right,
and so on. And she pointed out that none of them have actually worked. And the reason they don't work is the government sets the price for the carbon. And then they say the price is going to go up by a certain amount, and they distribute carbon credits to companies that are not doing it. And when it comes to the moment to raise the price, they never do it. They never raise the price because it's too hard to do the price raising. And so I have now been kind of convinced that if we could create a market for carbon, which is what Nori's trying to do, where you find out how much people are willing to pay to reduce their carbon, that would be great. But the only way that will work is if the SEC mandates you've got to decrease your emissions, right?
This sounds like the basis for a rich conversation, not here.
Yes, and
perhaps we could do that.
Yeah, I'm fascinated. I'd love to learn more because every time I talk to somebody about it, it gets more complicated for me.
I point to the Canadians who have instituted carbon pricing, and they did it in part because British Columbia had done it and done it successfully. So there's a very definitive model not that far from us where carbon pricing worked. And I'll leave it at that. Thank you so much, and Sid, thank you for calling on me, and everybody, thank you for granting me this time.
Thanks.
So there are a lot of great questions. I'd like to take one that's specifically around healthcare systems. So Kurt, early on, you had a question about accreditation agencies. Do you want to ask that?
Yeah, sure. I'd be happy to. I just basically wanted to know if either CMS, the payers, the federal payer, CMS, or whether or not the accreditation agency, the Joint Commission, has had any input into healthcare systems on whether they ought to establish climate emission, greenhouse greenhouse gas emission goals or anything in this arena? Are you aware of anything?
Yeah, so CMS has the Office of Climate Change and Social Equity that was started under Biden 2 years ago. And they have had a lot of conversations with people in healthcare about what should be the next step. I'm incredibly disappointed at the choice that they made, which was, we'd like you to volunteer to be part of our voluntary group that says they're going to reduce their carbon emissions, right? What I would like to see CMS do, and my recommendation to CMS, which they paid no attention to at all, is treat it exactly like you did quality, right? So
Yeah.
I think the first quality metric was aspirin at MI. And I remember when that came out, it was something like, 50 or 60% of patients who should have an aspirin MI got one. Within 2 years, it was like 95%. The moment they started measuring it and people started tracking it, it was amazing how quickly it changed. And that's true with all the quality metrics. Now, we do have way too many quality metrics right now, but if they just did it the exact same way and said, we need you to report what your emissions are, we're going to use this as the standard, and then we're going to ask you to take it down every year by a certain amount. And we're going to give the hospitals that take it down the money that the hospitals that don't take it down should get. I mean, exactly what they do in quality, right? It doesn't even cost them any money. So in quality, if you're a high performer, you get bonuses. If you're a low performer, you get penalties, and they take the penalty money and pay it to the high performers. They should do the exact same thing with climate. And if you could all tell them that, I'd appreciate it.
Anything from the Joint Commission? Anything coming from them?
I don't know. I don't know what the Joint Commission's doing.
Okay, thank you.
Let's see. Troy, you had a question about health systems. If all health systems switch to electric, how would we fare in terms of the grid? I think you may have partially answered that, Neal. But did I capture your question, Troy?
Yeah. Well,
Yes, sorry, I can't show my video right now. But yeah, I was wondering just more of New Hampshire's current power grid and whether or not it could sustain multiple places switching to all electric.
Yeah, so that's a good question. I do not know the exact answer for that, because it really would come down to how much of their hospitals, they wouldn't be able to switch to all electric for years, right? We just don't have the capability for doing that. You'd have to build brand new hospitals. So it's how much of their current buildings are on natural gas or oil and making the conversion to electric. So I think my guess is they would not be able to do it unless they also added renewable energy power capabilities at the same time.
Thank you. Bob McClellan, do you want to ask your question?
Yeah, thanks. So Neal, you had talked about kind of new technology for making concrete and how important emissions are. And I just read an article, I think it was in National Geographic or someplace, that although it's a great idea, there are concerns about structural integrity that we really don't know enough, because when buildings are built, or for that matter, many other things with concrete, they typically are meant to last for a long time. So what do you know about kind of long-term integrity of concrete made in the ways you suggest?
This is why you're asking such a great question, because this is actually why I love this climate change, because I spent all these years studying healthcare, and it wasn't very complicated. It's unbelievably complicated. And then you go into climate change and you're like, does the concrete have enough structural integrity? I don't actually know. I do know the claims of Carbocrete and some of those other companies is that it has 20 to 50 times greater structural integrity. And they are now building high rises in California with this kind of concrete. So that's all I know. I'm not an expert on concrete. I do remember when I went to University of New Hampshire, there was like a whole floor in the library of concrete books. So I assume that the University of New Hampshire has experts on concrete. Maybe I'll have to go to that.
Okay, thank you so much. I wanted to let Kathy Kemper, who put a note in about the presentation, wanting to be able to share it with hospital CEOs and university presidents, that it will be posted as an AV at our website, so you can link people to that. I don't know if your slides will be available separately. She had asked about
Sure,
that.
I'll send those to you. Yeah, absolutely.
Okay, That's great. So we can post those. And then we are just about at time, but I think, I'm sorry, Lois, Cody, you had a policy question, and I'd love to hear you voice that and your thoughts about it. Neal. I can read it if she can't unmute.
I'm sorry, I'm very slow with the fingers in this tablet.
It's okay. You get
Well, I'm wondering what you might suggest for strategies if the pending decision from the Supreme Court is not supportive of EPA and its functions. We got a decision that came down today that was not good. Yes.
Yes,
Yeah. So I'm just
yeah.
wondering.
That's
Thank
why I spent a long, before 2 years ago, when I decided to combine my vocation with my avocation, I spent all my time on climate and environmentalism working through the political process. And I haven't given that up, right? But I am very discouraged by it. I do not feel like we're moving nearly fast enough with the political process. And I've decided what you guys are doing and what people are doing around the country, or we just say, we're going to start working on it ourselves. We're going to start trying to get people to change, organizations to change. We're going to tell them, as you have as physicians, we want to see change. That's the way to go. We're going to have to, and I don't give up on the political stuff, because I think particularly physicians have a huge impact on politics. But I'm very discouraged by that part of it. I'm super encouraged by technology, young people working on it, a lot of drive in this, but the COP meetings haven't made me really happy, and I'm not super happy about, where the US government's going.
So I'm gonna just jump in and say, so we should just jump in and take over.
So I think
Yes.
that's actually a great
Thank
place
you.
to leave it, because Neal, the title of your book is How Healthcare Stops Climate Change. And I think what you just told us is to really use our voices and to lead. And I think we will try and do that. So we're at 10 after. I thank you again, Neal, for a really terrific presentation. Apologies to anyone if we left a couple of questions unanswered in the box, but maybe over time we can answer them. Thank you, everybody. Happy summer.
Thank you so much. Thanks for
Enjoy
taking
the-
the time. I really appreciate it. Thank you, everybody.
Enjoy your evenings. Thank you, Neal, so much. Thank you, Emily, for your orchestration.
Thank you very
Thank you
much.
all
That
for
was
attending.
excellent.
Okay.